Hello everyone, and welcome back to our channel. Today we're discussing a topic that often comes up out of curiosity or the desire to try new things in a relationship: anal sex. While it's a practice some couples explore for sexual satisfaction, it's crucial to be aware of the potential health risks involved. It's often referred to as unnatural sex not just because of anatomy, but because of the specific health concerns it raises. So let's dive into the 6 major dangers and what medical professionals advise. First and foremost, let's talk about the risk of tearing. This is one of the most common and immediate dangers. Unlike the vagina, which is naturally elastic and designed to accommodate intercourse, the anus is not. Its primary biological function is excretion, to let things out, not take things in. The tissues inside the rectum and anal canal are delicate. During anal sex, these tissues can easily tear. These tears can range from tiny, microscopic abrasions to larger, more significant injuries. The immediate consequences are pain and bleeding, but the bigger issue is that these tears create an open door for infections. This brings us to our second point: the increased risk of sexually transmitted infections, or STIs. The lining of the rectum is much thinner and more fragile than the vaginal lining. When those small tears we just mentioned occur, viruses, bacteria, and parasites can easily enter the bloodstream. This makes the transmission of STIs significantly more likely during anal sex compared to other forms of sexual activity. Common STIs that can be transmitted this way include HIV, gonorrhea, syphilis, chlamydia, and hepatitis B, even if you're in a monogamous relationship. It's a risk to be aware of, especially if either partner's full sexual history isn't known. Now let's focus on a particularly concerning STI HPV, or the human papillomavirus. This is our third major danger. There are over 40 strains of HPV that can be sexually transmitted. They fall into 2 main categories: low risk and high risk. The low risk strains are what typically cause genital warts, which can appear on the genitals and around the anus. While not cancerous, they can be uncomfortable, unsightly, and require medical treatment. The higher risk strains, however, are a much more serious concern. HPV types 16 and 18 in particular are strongly linked to several types of cancer, including anal cancer. Because anal sex can create those tiny tears in the skin, it provides an easy entry point for the HPV virus. It's also important to know that HPV is transmitted through skin-to-skin contact. This means that while using a condom can significantly reduce the risk, it doesn't offer complete protection, as the virus can be present on skin not covered by the condom. Our fourth point is a practical but important one. Screening for STIs in the anus can be difficult. When you go for a routine physical or a standard STI checkup, anal screening is not typically included. You have to specifically tell your doctor that you engage in anal sex and request to be tested for anal STIs. This requires open and honest communication with your healthcare provider, which can be a barrier for some people. Without this specific screening, infections can go undetected and untreated, leading to more severe health complications down the line for you and potentially for your partners. The fifth danger is something you might not immediately think of: urinary tract infections, or UTIs. The anus is home to a high concentration of bacteria, including E. coli, which is naturally present in your digestive system. During anal sex, it's very easy for these bacteria to be transferred from the anal area to the urethra. Once there, they can travel up into the bladder, causing a painful and uncomfortable urinary tract infection. While UTIs are generally treatable, they can be a recurring problem and, if left untreated, can sometimes lead to more serious kidney infections. Finally, the sixth danger is a long-term and potentially life-altering one: fecal incontinence. This might sound extreme, but it's a documented risk. The anal sphincter is a complex group of muscles responsible for controlling your bowel movements. Repeated anal sex can, over time, damage or weaken these muscles. A study from Northwestern University in the U.S. found a link between frequent anal sex in women and an increased likelihood of experiencing fecal incontinence, which is the inability to control your bowel movements. This can also sometimes lead to urinary incontinence. This is a serious medical condition that can dramatically impact a person's quality of life, confidence, and daily activities. So, with all these risks, what do doctors advise? The most important piece of advice is to be proactive about your health. If you choose to engage in anal sex, taking safety measures is non-negotiable. First, always use a new condom for every single encounter. This is your best defense against the transmission of STIs, including HIV. Second, lubrication is absolutely essential. The anus does not self-lubricate. Using a generous amount of a high-quality, water-based or silicone-based lubricant is crucial to help reduce friction and minimize the risk of tearing and tissue damage. Third, listen to your body. Pain is a clear warning sign that something is wrong. If you or your partner feels any pain, you should stop immediately. Pushing through pain will only increase the risk of injury. Communication is key. Fourth, hygiene is important. Gently cleaning the anal area before and after sex can help reduce the transfer of bacteria and lower the risk of infections, like UTIs. And most importantly, maintain an open dialogue with your doctor. Get regular health checkups and be honest about your sexual practices. This allows your doctor to provide the best care, recommend appropriate screenings, and give you personalized advice to protect your health. Talking about these things can feel awkward, but your doctor is a professional there to help you, not to judge you. Your health and well-being are paramount. Making informed choices about your sexual activity is a critical part of taking care of yourself. Thank you so much for watching and for taking the time to learn about this important health topic. If you found this video helpful, please give it a thumbs up. Do we not forget to subscribe to our channel for more content that empowers you to take charge of your health. Stay safe, and we'll see you in the next video.